Hello, my name is Matthew Tindall, and this is a project for the stage management class at Westchester University. And today I will be talking about basic first aid for the stage manager. Please keep in mind, I'm not a medical professional. I'm just trying to share some uninformative presentation. Firstly, the most important part of first aid is what is in your med kit. So these are the things that you'll need in your med kit. Various gauze rollers, adhesive tape, band-aids, scissors, tweezers, wipes, Neosporin, gloves, elastic wrap, triangle bandage, splint, resuscitation device, and directions for requesting emergency assistance. Second thing to note are some common injuries that will occur. I want to talk about the common injuries before I get into how to actually use each item so that we know what we have to be keeping in mind. Various common injuries that might occur are cuts, bumps and bruises, scrapes, and pulled/strained muscles, especially when dealing with dancers. So now let's get into some of the items that we mentioned earlier in our first aid kit. Firstly, we have band-aids for minor cuts. Next are instant cold packs for any strains, bruises, and muscle injuries. Again, very common with dancers or dancing in general. Next, we have gauze, which are usually secured using the adhesive tape, the medical adhesive tape, or using a gauze roller bandage, which can also be used by itself. And I have a quick video of someone using a gauze roller bandage for us to watch. So as you can see, he is wrapping this around whatever injured area he may be experiencing. And because this is on his leg, he is using the entire roll, but that is not always necessary. And that is why he has the scissors. And at the end, if you have a safety pin, you can safety pin it, or you can tuck it under, just like he has done. Next, we'll be talking about different items that would be used before you start treating the wound, such as the alcohol-free cleansing wipes to clean the wound, and the gloves, which should always be put on before you do anything with any injured person. You should be wearing gloves so as not to infect any of their wounds. Scissors and tweezers. Tweezers are obviously just for if anything is stuck in the wound, for instance a splinter, you can use the tweezers to get it out, and the scissors are for if the person you're dealing with is incapacitated and it looks like the injury is under a t-shirt or item of clothing. Instead of trying to remove that item of clothing and risking further injury, you just cut it off so you can get directly to the wound without moving it. And lastly, Neosporin. Again, with any cuts, you should put this on before you put the bandage on because it'll help heal and relieve pain. Next, we'll be talking about elastic wraps. I have a quick video. So this is showing how to place elastic wrap on an injured ankle. So you start by wrapping around the arch of the foot once, wrapping around the arch of the foot again, and then being very careful not to hurt the person's injured ankle. You lift their leg up, leaving the ankle supported on the ground, and wrap above, right on the Achilles, and then back around to the arch. And you repeat that process until the entire elastic wrap is done. This can also be done on the knee in a very similar fashion, and those are the most common places where you will need it. And most elastic wraps will have Velcro on the end that can be used to attach to the elastic wrap so there's no tucking needed. Okay, I'm going to go through the rest of the items and then show you a video for each of them. We have a triangle bandage, which is used to make slings, a splint, which is used for broken arms, and a pocket mask, which is used while performing CPR. And I'm going to show you a video for each of these. This is for the sling. You should place the long edge vertically the long edge is vertical, and you place the corners as you see here with the person's arm over top. And then you grab the bottom corner and bring it over the other shoulder and tie it in the back so as to secure the person's arm. Now for the splint, it is usually used for broken forearms.
Have your partner support the extremity above and below the injured site. In this video, we are simulating a mid-forearm fracture. Ensure that you have circulation, motor ability, and sensation in the injured extremity.
A radial pulse. Can you squeeze my fingers? Can you feel me touching your fingers?
Prepare your splint so it will properly fit the area you're going to be splinting. Gently apply it to the patient's skin while minimizing movement of the extremity. Using gauze or Coban, secure the splint to the patient's extremity.
We could use our roller bandage or adhesive tape for that.
Ability and sensation after the intervention.
A radial pulse. Can you wiggle your fingers? Can you feel me touching your fingers?
Yes. Now we're going to look at a video on how to use the pocket mask. As you can see, the pocket mask is put in place with the little nozzle pointing up. That's very important. And the bottom strap is in between the chin and the bottom lip. You're going to place it on the person's mouth before you start chest compressions, and then you're going to do, we'll get into the reasons for all this, but you're going to do 30 chest compressions, and then the mask assists you in breathing into the person. You put your fingers down to create, you push down on the mask to create a suction so all the air goes into the person's mouth and nose, and then you take 2 slow, shallow breaths into them, just enough to raise the chest. The last thing that you need in your kit is directions for requesting emergency assistance. For us, that is going to be a card or piece of paper in the first aid kit that has public safety's number on it, and in the case of any medical emergency, public safety should be contacted instantly so that they can further assist you in helping. Now we're going to learn about CPR. I don't have any verification. I'm not CPR verified, so I'm going to show you a video because it is better to know something than nothing, but I do encourage, if you plan on stage managing, to get CPR verified. But first we're going to go through a few bullet points. The first thing you want to do is check for consciousness. Then lie the individual on their back on a hard flat surface if they are not already like that. Then check for signs of life for no more than 10 seconds by checking to see if you can hear their breath or just any type of consciousness. If not, start your compressions. You do 30 chest compressions, and then you give 2 slow, gentle breaths into the mouth. And then you repeat those 2 until you see signs of life or until help arrives.
Check the victim for consciousness. Gently tap their shoulder and shout.
Are you okay? Are you okay?
If no response, call 911 immediately.
You, call 911.
If the adult is lying on their stomach, turn them over and to their back. They should be lying on a hard, flat surface. Check for breathing and signs of life. Watch their chest for any normal movement. Look for signs of life and breathing for no more than 10 seconds. No breathing or signs of life, begin CPR. Position the heel of one hand on the center of the adult's chest. Place your other hand on top. With your elbows locked and arms straight, lean over the adult's chest and compress the chest 2 inches in depth, 30 times.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
After 30 compressions, give breaths. Give breaths by tilting the head back, lifting the chin, and pinching the nose. Place your mouth over theirs and give 2 slow, gentle breaths.
This is where we would use the mask we had, or the pocket mask we had earlier, to assist us in this if we have it readily available.
Just enough to make their chest rise. Continue.
And you repeat that process again until you see signs of life or until help arrives. Thank you all for joining me. I hope this helps you.